He says, will level 4/5s be transferred from the counties to the national government? The second one about the cancer treatment. And the third one was, will you support, if confirmed, to create the National Health Service Commission? I think there is some doctor somewhere who is sending this message to all of us. I've received it 3 times.
And there's a fourth one, Chairman.
Yes.
The fourth one was regarding NHIF.
Yes.
In one hospital, will she change the policy that it should not just be one hospital nominated? They can go anywhere, so long as they've got NHIF. They do not have to go to one hospital.
Actually, that is part of the law you passed recently that is being challenged in court, isn't it? Go ahead and answer.
Through you, Chair, I thank you, Honorable Member, for the questions.
Yes, Nelson?
The purpose of this, if you just told the nominee, is actually so that you can address the members by their names.
Yes.
And this is the Committee on Appointments, just for your information.
Yes. So don't just say Honorable Member. That one is called Honorable Dawood. Okay,
my humble apologies for that.
Yes.
I will address them by the names.
Go ahead.
Thank you, Honorable Dawood, for the wonderful questions. First of all, I would like to talk about local production of medicines and consumables. I think that Kenya, we need to embrace this. Local production of medicines, the health products, is really one way to reduce the costs of medication. And so it's an area that we need to embrace as Kenyans, and based on the budget, then we can consider strengthening this. In addition, regarding the NHIF, the universal health care looks at offering accessible care, affordable care, and quality of care to all Kenyans, including the vulnerable and those with disability, among others. And so the issue of only being able to be seen in one hospital is not part of the universal health coverage. And hence, I believe that once we have implemented the UHC, first of all, the community health promoters will be able to improve the prevention, promotion, rehabilitative interventions within the community. So even for cancer cases, they'll be educated on preventive measures, and those who are having terminal illnesses, rehabilitation will be ongoing. Equally, strengthening the primary care networks is critical because it's the first contact, and it filters the mild cases, ensuring that the severe cases are the only ones going to the other levels of care, and hence there's reduction in the overwhelming of other levels of care. And so I believe that we can have this as accessible, affordable, quality care by strengthening our community health promoters or the community health programs, as well as the primary care networks, and ensuring that we are offering quality care across all levels of care. So regarding the specializations such as in oncology, as discussed earlier, we have the East Central Southern African College of Physicians, which is a program that is running in multiple hospitals within the country, supporting doctors to specialize. We may also consider having this for other specialists, including the nurses, and see how to see how they can grow career-wise as the health workforce, and that way we can also have access to care. For the doctors at the national team, I believe it will be a consultative approach. I cannot make that decision myself. I believe that it's critical that I involve the whole team, the stakeholders, the partners, and other sectors to be able to see how to address this issue.
Point of order, Speaker. Which issue? And I thought if it is about the commission, health, what is your opinion, nominee minister? If you say consultative, what is your opinion as a leader? Do you support, you don't support, even before you do consultation? What is your input? What is your mind? Yeah, yes. you are running away from being personal.
Yes.
We want to get your suitability, you, not a group, but you. Thank you, Speaker.
Go ahead.
So
the question is, if you are confirmed,
yes,
will you support the creation of the National Health Service Commission? There is some doctor somewhere sending this to all of us.
As part,
ask you.
Thank you, Honorable Chair, and thank you, Honorable Members. As part of the doctors' fraternity, I support the National Health Service Commission. Thank you.
Go ahead, Mary.
The one for level 4 and 5 to move.
I'll help you to answer.
The level 4 and 5